You all might know that the Office of Community Engagement, along with a few other programs within the Cancer Center, do offer pilot awards awards for pilot projects for the year. And three were chosen last year or at the end of last year. And we actually have some of our CAB members who actually participated in the review. So thank you again for assisting with that. And so we will have two presentations today, one from the United in Love Community Wellness Outreach Project, and one from Cancer Choices, Empowering Patients, Informing Practice, and a community study of complementary cancer therapies. Now, one thing I did not do was figure out if one wanted to go before the other. But since Shonda, since I see you, would you like to go first?
We are happy to, yes.
Awesome. Well, I will give you the floor and hopefully you can share screen.
Well, I'll be sharing my
Oh,
screen. So I'm going to send a request to be able to do that.
okay.
I think I pressed allow.
Okay, let me try again.
Sorry about that.
Oh
You
yeah, no,
should be
that's
able,
okay. Yeah, ready to
there
go.
we go.
Great. So I'm Christine, and I am the community partner with Shonda for this a project that we're really excited about. And I'm going to start us off with the presentation. Our study is Empowering Patients, Informing Practice, a community study of complementary cancer therapies. And Cancer Choices is a nonprofit that we're under the hood of Commonweal, which some of you may be familiar with. It's been up in Marin for about 50 years, and we're one program there. Overall, we're hoping to collect and analyze community data about, integrative and complementary therapies being used by cancer survivors in the greater San Francisco Bay Area. And really, this is coming from a need for reliable information on therapies that are of interest to people, in response to the amount of misinformation available online that people come up against. And we hope that these findings will help to bridge a gap between what clinical research there is, what community interests are, and to really kind of help clinicians be able to understand what the interests of the community are to just bolster better communication. Again, who we are. I'm Christine Meinert. I lead the Cancer Choices program at Commonweal. And Commonweal is up in Bolinas, and they've been hosting retreats for people with cancer for 40 years. The Cancer Choices program is a patient-facing website that's free. And we compile the evidence on different complementary therapies, really just kind of unbiased, straightforward summaries of what evidence is there for different therapies of interest, and also talk about, lifestyle practices and provide expert webinars and educational materials for folks who are navigating a cancer diagnosis. And Shonda, I'll let you introduce yourself.
Sure. Hi, everyone. So excited to be here with all of you today. My name is Dr. Shonda Williams, and I am a postdoctoral research fellow here at UCSF at the Osher Center for Integrative Health. And the focus of my research has been primarily looking at cancer disparities among other research topics. So very excited to partner with Christine and Commonweal today.
Great. So I'm going to give a bit of background, why we're pursuing this. Again, there are lots of stats around how many people are pursuing complementary therapies or CAM, complementary alternative medicine. And it's just something that people are interested in, and there aren't a lot of great guidelines for clinicians to be understanding the real risks, the real benefits. ASCO and the Society for Integrative Oncology have started to put out clinical guidelines on some of these therapies, which is a great step forward for kind of bringing forward that evidence to a broader audience. And, there's a lot of great literature on some of the, lifestyle practices like diet and exercise, really impacting kind of quality of life for people who are going through cancer treatment. So there's a lot here. There's a lot, it's difficult to tease out. And so it's just kind of an overwhelming amount of evidence for not only clinicians, but people navigating care. So we wanted to kind of approach this from the community lens and understand what are the interests and needs of the community for this information. And yeah, so also coming from just the rise in health misinformation. One kind of specific example of this that I've seen in my work with Cancer Choices is we have pages with the very limited to no evidence for a couple of off-label drugs in cancer. Albendazole and fenbendazole, both are antiparasitic medications that have become kind of viral trends online. And we have pages describing the extremely sparse evidence, but those pages have been getting over 20,000 visitors a month for us over the past year. Some of that was because Mel Gibson mentioned these therapies on a podcast, but it's really just become apparent, like people really want this information, and there are a lot of sources providing not credible information. And so this study is really trying to understand, what are the needs to kind of help fill the gap of high quality information for the community. And there's also this gap of patient to provider communication because, clinicians also don't have a lot of, clinical guidelines, as I've discussed before, to lead from on these topics. So that is kind of where we're coming from in terms of a community lens. And I'm going to pass this over to Shonda from here. Thank you.
Thanks, Christine. So our primary goals are pretty straightforward and very important. We want to understand how community members are engaging with complementary cancer therapies, what they're using, why they're using it, and how they're making these decisions. And so the goal and the hope is that by grounding our findings in lived experience, we hope to improve communication between patients and providers and provide more support for patient-centered education. So ultimately, this is about aligning between what patients need and what the healthcare systems are prepared to offer to people.
Great.
Next slide. In terms of a timeline, this is a 12-month long project. We have developed a survey, and so we're about to send out that invitation to other community partners and begin the community outreach aspect of this work, followed by data collection. And the data collection will be done through both surveys as well as interviews. We'll move into analysis and then finally into dissemination, which will include some community-facing educational offerings, as well as providing clinician summaries. So we designed this timeline just to ensure that we have, adequate and robust community input, but then we also want to make sure that it's meaningfully translated into usable outputs. Next slide. So this is a screenshot. If you were to click on the link from your smartphone, what it would look like. So I just want to share a little bit about what we'll be actually asking the participants. The survey explores a variety of types of complementary therapies, as Christine mentioned, and how people are using them, what they perceive as being effective, as well as the decisions that they make around using them. We're going to ask them questions in regards to their quality of life and, most importantly, communication with their healthcare providers. So we plan to survey about 200 individuals and then conduct more in-depth individuals with another 10 to 20 participants. Each participant will receive a gift card for participating in appreciation of their time. And it's a mixed methods approach. So we're hoping to capture both breadth as well as depth of experience. Next slide. So this work is only possible because of a variety of very, very strong community partnerships. We're collaborating with a range of organizations across the Bay Area, including integrative cancer clinics, survivorship groups, and community-based organizations, recognizing that these partners are essential to assist us with recruitment, as well as to ensure that the study remains grounded in what the priorities are of the communities, as well as the realities that they face. And so they will also play a key role in how we disseminate and share the findings and how they go on to be implemented. Next slide. Finally, I want to emphasize that this project, along with collecting data, we are hoping to give something back. So we will create some accessible summaries of the findings for community members and share them directly with participants as well as the partner organizations. And we'll develop a series of free expert webinars based on those topics that emerge as being most important to the community. And lastly, we'll produce a clinician-facing summary to help inform their practice. So we want to, again, support patients and providers and the community organizations as well. So thank you so much for your time and your attention. We are very, very grateful for your support. And Christine and I both see this as being part of a larger effort to continue that approach of having more patient-centered work. So really implementing the patient's voice and strengthening trust. And again, helping folks kind of weed through a lot of misinformation and disinformation out there, and hopefully build more responsive models of care for folks. So we're happy to answer any questions and would love to hear any thoughts you have as well as your feedback.
Yeah, thank you so much.
Awesome. Thank you all so much. We can take some questions, and it looks like hopefully you're paying attention to the chat and all the clapped hands going up the screen. At least that's what I see on my end. But we have a few hands up if you want to start with Gary.
Thank you. Excuse me. Thank you for your presentation. I'm really curious as to whether or not you are dealing with specific cancer types, right? Or is this more generalized practices that are complementary to whatever cancer types? Because different therapies for different cancer types may be appropriate and some not appropriate, right? And then I saw you said that you were giving $25 gift cards out, right? Is that for the interview and or for the the survey or both, right? Sorry about it.
Yeah. So we have that $25 gift card as a kind of thank you for the time spent either taking the survey or the interview. And yeah, thanks for bringing up the different cancer type question. We're letting this survey kind of encompass all cancer types. And really, we're not necessarily trying to figure out what works in terms of complementary therapies. It's more trying to look at like what are people interested in, and kind of just to understand like more of a broad scope, like what are the community's broad interests and like what are these different types of therapies and how are they perceiving them to be effective or why are they using them, and less so about like did this work for this kind of cancer. Does that help clarify?
No, I would think that efficacy would be your most important consideration when you look at, types of the treatments and therapies.
Yeah, I think to really understand the efficacy of something, we'd really need to be doing more of a clinical trial, where we could really have one intervention of interest and really kind of control the other variables. So with a community survey, we're really just more learning about information kind of seeking behaviors to help with communication and then sharing and education on those topics of interest.
And sharing that with the clinicians is for what purpose?
Just so clinicians can see what it is their community is interested in, which would help then, give clinicians insights into what they might want to have more resources and educational materials on for those people that are coming in to see them. That's the hope.
And Gary, I want to just want to add that we are asking people about what they're utilizing and how they feel it might be effective. So there is kind of like that kind of perceived effectiveness that we're also investigating as well.
Would you consider having an alternative survey with clinicians to see what they perceive to be most effective practices, right? And then if they merge with some of the patient surveys with regards to outcomes, right? We find patients say this, and now clinicians are saying this, right? Then you have a compatible type of outcome. But from the perspective of just having patients who perhaps may be newly diagnosed or never have cancer treatment, they may be totally oblivious of the types of practical services that are, effective. I mean, as a cancer patient, that's what I'm looking at from that perspective, right? I wouldn't want to go in and tell my oncologist what I think is best. I'd like to,
Yeah.
I mean, I'm just,
Yeah, and I think a lot of this is again around like just trying to, because there's so many different options for people and there's so many different things that what it's really trying to elevate like what are the big topics of interest so clinicians can have at the ready information when people come in with something they're interested in pursuing. And yeah, I think we wish that we did have a scope big enough to be able to understand like true efficacy and to really investigate clinician and provider and patient insights. But I think for this small scope, it's really just about understanding what's happening in the community, and that this would hopefully be a seed for more, kind of a larger initiative based on what comes out of it.
last question. You mentioned clinical trials. Are you planning or prepared to match your outcomes with clinical trials that are in the community that perhaps are compatible, or, so that then you could say patient perceived best practices, clinical trials in the community that are forthcoming, clinicians' point of view, et cetera, and then merge all of those findings into a best practice or a best outcome type of survey?
I mean, I think for our scope, that's probably not, we don't quite have the scope to be able to pursue, like, understand the breadth of, we probably have like 40 or 50 different kinds of therapies, that people can check off in the survey. So that's, I think, a little bit broader than what we can do with this pilot. But as I did mention, ASCO is collaborating with Society for Integrative Oncology to put out new guidelines that where they are the ones they're pulling together all of the clinical research that's out there on like fatigue and cancer and like what are the integrative therapies that have clinical evidence. So that's one resource that already exists, and it takes a whole big team of researchers for them to really compile all of that for folks. But yeah, that's something that would be very useful too.
Thank you.
Yeah, thank you.
Thank you, Carrie.
Sharon, did you have your hand up still?
Yeah. So I'll just, if I may, Christine and Chandra, just to also address Gary's question. It's one of the issues is it's very challenging to do a clinical trial on alternative complementary medicine, often because it's very individualized. So for example, an acupuncturist seeing a person for the same condition might actually provide different herbs and medicines and acupuncture points because they're really individualized, and it is one of these challenges that makes it a little harder to study. So just adding that as information.
Yeah, thank you so much. Yes, it is it's a broad, complex topic that we're looking in.
Right. So I had two quick questions. One is, have you considered adding, I understand that you're recruiting community support, Women's Cancer Research Center, other, organizations, which is great. But I'm wondering if you've thought about including users in designing and evaluating your survey. So for example, I work with the Patient Family Advisory Council at UCSF, and it's amazing when I bring surveys to them that I think are really well, the verbiage is great and it's really clear. They always have such an interesting perspective. They're, coming at it from so many different angles. So that might be something worth considering before you send it out, to actually share it with some patients. we have many patients interested in integrative medicine at our PFAC, if that would be a forum that you'd like to bring it to, but I'm sure that with the community, there are other forums, but just something to consider, and maybe you've already done that. The other thing that came to mind is the Osher Center, which of course I'm sure you're familiar with at UCSF. That's our integrative arm of medicine, and they work closely with our cancer center and physicians, and obviously have a lot of the data that you're looking for about UCSF patients in terms of which types of integrative therapies are most used, are most popular. And, even at UCSF, that with Osher being part of the cancer center to some extent, or part of UCSF, there is a bit of a divide between the allopathic practitioners and practitioners at Osher Center. And so that might be something worth looking into, talking to some of the Osher Center physicians or cancer center physicians, so that you're working synergistically and using some of the data that is already in the community to bolster your study. So just a thought.
Great. Thank you so much.
Isabel?
Thank you. Is my mic working?
Yes.
Can hear you.
Great. Thank you. I appreciate that. I've had some issues. This is a wonderful idea. I've always wondered about it, but more particularly, the question is it multilingual and multicultural? Because I think that when you talk about alternative medicines, in some communities, you really have to define what does that mean. You have to. I mean, we worked a lot with low-income Spanish-speaking, immigrant, et cetera. They brought their own alternative medicines or ideas about what those were with them. And I can say that even if they've been in this country for 20 years, they're still using some of those alternatives for multiple issues, not just cancer. So I think that in some ways you need to think outside the norm for a multicultural community about what they consider as alternative or complementary versus what you have described and defined as alternative and complementary, and the lists may be very different. And I think it then begs the question, are you going to get the right data for the right group for the right time? I just know that we have to sometimes think outside the box to be sure we've captured all of the information out there, and some of it may actually be working. It's that old ancient remedy that has impact in some ways, even if it is emotionally supportive. Mm-hmm. They think this is something good, this will help, and it quiets the nerves, and it makes them think that it's a remedy that works for them. And to take it away is to sort of like take away religion. Mm-hmm. So it's really critical, even with the conversation with the clinician, that he doesn't immediately poo-poo when they say, well, I have this old-time remedy, where we use cactus flowers and we do this and we do that, and he immediately, it doesn't work, or you can't use that, or it doesn't matter, that sort of stuff. So I'm wondering if this is broad enough to take that thinking and that survey into consideration.
Yeah, and again, I think, this is like kind of a slice of, this whole world for a small pilot study. So we've kind of tailored this survey again, really around what are people using, what's the perceived effectiveness, and like how are they getting their information. So I think that's like a fascinating topic that you've brought up, which is this whole other dimension of, okay, maybe this isn't just clinically relevant to someone, but it is spiritually relevant. So we weren't able to expand into that dimension for this project, but in terms of making sure it's culturally approachable, we, instead of just using general terms like complementary throughout, we're spelling it out quite a bit. And, in the survey asking, going through different categories of supplements, botanicals, mind body practices, and not just saying that word at the top, but really spelling out what might be there. So I'm hoping that, and there's always, an open gap for people to put in something else that they may feel fit, that we haven't captured. So that's how we've approached it, is just to try and be quite explicit with it and to, define how, if we are using a word like complementary, kind of share how, what that means in that context. And we are only undoing it in English. Unfortunately, again, just the scope is, not quite resource-wise. We're trying to make sure we don't take off more than we can do for a pilot. But yeah, Shonda shared the inclusion criteria, and one of which is completing an online survey in English. So we do have that kind of limitation in terms of the community that will be responding.
And also, Gary had a question that I responded to in the chat. And so I'm a fellow at the Osher Center. And so UCSF Osher Center will store the data.
You did mention that you will be sharing it with other community partners and et cetera, right? So
yeah, we'll be summaries. I think we won't be sharing out necessarily all of the raw data, but summaries that people can use and understand the results from.
understood.
Wonderful. Thank you all. Great talk. Thank you for bringing us up to speed on what you all have been doing. I look forward to hearing more about it and as the study progresses and getting more input.
Yeah,
Now,
so
go ahead. Go ahead, Christine.
I just wanted to say thank you for having us. It's great to come in and meet everyone.
Yes, indeed. These were definitely some of the folks who were reviewing you all's proposals. Awesome. All right. I think this is likely a good time to transition to our next presenters, our partnership between Dr. Megan Morris and Lisa Nguyen of United in Love. And we will turn it over to you all to give us updates on you all's pilot project.
Hi, everybody. Do I just go ahead and share my screen?
Yes.
Yeah. Hi, everyone. Hi, Dr. Palmer. Hi, everyone. I just didn't meet. Go ahead and share my screen. Allow to share screen. Share this window. Okay, let me know if you guys see that.
We can see it. It's just not in presenter mode yet.
I did what have you?
It's just not in presenter mode yet.
Okay, let me see. Be in. Okay. Are you able to see it now?
Perfect.
Okay. All right. So United in Love is our organization. We've been around for up to 8 years. My name is Lisa Nguyen. I am the founder and the acting director. And United in Love created the Community Wellness Outreach Program in regards to the UCSF outreach proposal. And our PI is Dr. Megan Morris. And then I just want to go in to talk about this work and how this work is very important. Me, the founder, Lisa Nguyen, I am a survivor of gun violence, and I lived in this community. And the people that I research are my neighbors, are my family, and the people that I knew that grew in this community. So this work is very personal, and it's really baby. So this is what this work is rooted in, and it's about. So who do we serve? We serve in District 10, 30,000 residents, primarily African American, which you can see here is 33%, Hispanic Latinos 25%, Asian Pacific Islander 25%, Caucasian 12%. And then if you look here, there says other, but if you look at the boxes below, 12.3% live below poverty line. 37% of the households speaking in non-English English is not their first language, and 60% of the residents in Baby Hunters Point are on Medi-Cal or public assistance. And the number one insecurity that we have is food challenges, and basically this really hurts our seniors. And here, when we did some of our surveys, as you could see here, Annette Scott, she's a Bayview resident, and some of what she said was, "It's so unfair. It is disgusting." If you look here, this is one of the seniors that we do serve, Andre Phillips, Bayview residents. A lot of elderly, a lot of the elderly depend on this store, which we'll get into a second. Maybe I'm going a little too fast, but let me just back up. So in this crisis of when us doing this work, we really saw how Bayview Hunters Point does not have a pharmacy. And the fact that it serves 30,000 residents and we don't have a local pharmacy is really crazy, because we actually lost our pharmacy, I believe, more than 6 years ago. And so I just wanted to show this graph of how there is a pharmacy desert in Bayview Hunters Point. So our programs go into an integration of RAP mental health services. So within this this run, we did an 8-week peer-led cohort for participants that already suffering from different diseases, especially acute chronic diseases of diagnosis. If that is diabetes, that is cancer, leukemia, I mean, just you name it, right? And then Figures program. So the Figures program is also our youth-led program when it comes to, they're looking to get into a career, and we call them our little youth healers. So some of them are 13 through 18. So that's the Figures program, Fun Instead of Gun Use Rewards Everyone. And then our 18 through 26, our Tay Youth, that is our Clear Waters program, and that is the pathway to career component. And then Genealogy Prevention is a collaboration that we did with Sister Afatasi about family history. So I'm not going to go into all of this. I'm just, out of respect for time, I would say what we were able to do with this engagement, I just wanted to show you one of our key findings, and this was one of the preventative cares of us working with Bayview Hunters Point residents. If you see here, this is Myrtle Wilson. This is from our genealogy program. So if you see here on the left-hand side, if you guys can read this, it says, "This is a stunning photograph portrait of a parental grandmother, Miss Myrtle Wilson Wright. Her maiden name was Wilson." If I'm going to fast forward down here, it says, "Tragically, Myrtle passed away at the young age of 38 with uterine and cervical cancer at December 12, 1937, when her father was only 5 years old." So this component was one of our key findings, right? So I just want to go in about where your people are from, genealogy meets prevention health. This was something when we're working with our residents in Bayview to try to actually bring more awareness about cancer screening, about how do we plug them and kind of get them into UCSF. This component actually helped us identify prevention care within the Black community. So I just wanted to highlight that here. I can read a little bit. Afatasi McNeely, her work is actually featured in Woman Afrofuturism at the airport. Her 4 years of original genealogy research, restoring lineage-based knowledge in communities impacted by displacement, gives participants a folio of their family history and health patterns and ancestral story. I, Lisa, saw the genealogy was missing the key to health engagement in the Black community. The problem was never the lack of cancer screenings. It was the people would not walk through the door. And that is pretty much building trust, right? We deal with a community has been so hurt behind the trust factor, and I believe that is the reason why we built the RAP service, And that was really important to us of how do we engage with our clients to where not only we bring the mental health aspect, right? The therapeutic services. When they let us know what they're suffering from, we actually want to stay with them on this journey as we plug them into not only the resource they need, but the continuance of actually providing this prevention care, providing this new way of lifestyle for them, right? And so this is our year 2 of what we're trying to do, right? Deeper integrations, sustainable infrastructure, and also formalizing the RAP services and really bringing more integrations with clinicians. As we work right now with a few people, it would be nice to actually work with UCSF and to see how we could bridge that. Another thing that we have been really successful, we were able to actually access medical billing, but what hurts us is actually the 90-day reimbursement gap. This is something that we're hoping we can bridge this. And then our North Star is actually bringing a pharmacy to Baby Hunters Point. And we have civic leaders who also stand behind this, like the great Sophie Maxwell, the current supervisor, Shamal Walton, also Connie Chan, who's running for Congress, and also DJ Booker. But these are the 10 community leaders. This is some of the workshops, as you can see right here. This is the graduation on the right-hand side. This is me talking to other residents about healthcare. And then this is pretty much the end of my presentation. I really wanted to be respectful of the 10 minutes I had, but our North Star is bringing a pharmacy to Bayview through mental health services, but having us as the access point since we build the trust in Bayview for the last 9 years. Yes. Hopefully, did I skip too fast? You guys have any questions?
I'm going to recuse myself.
Thank you, Lisa. Thank you, Lisa, for your presentation. Just want to give space for Dr. Morris if she wanted to say any words. I think there's a little feedback online or someone's audio. I'm not sure.
Sounds more like yours. And mine, yeah.
Just want to really appreciate Lisa's work. The team has been incredibly connected with each other, and I 10 minutes is not enough time to really give all of the dimensions of the program that United in Love have been catering to Baby Hunters Point. I think it was like slide 3 or 4 where Lisa presented the grid of different program activities. I looked at that again and I just really was blown away with how they've thought about different ages in the community, thinking about pathways for people to support each other. And I think that that's a reflection of the opportunity to bolster a community-led project that is really embedded in the community, that is needing a very specific resource that was taken away. And that's one of many things that is a very concrete pharmacy, but some of the quotes that Lisa shared about what the pharmacy provided beyond what I think many of us in the healthcare service area think of, which is the medications, but none of those quotes were talking about the medications, right? So just again, want to just reiterate that Lisa and the team have a lot of trust and have also identified a lot of individuals within the community who have incredible knowledge that they were able to harness for a very short-term project that allowed us to learn about what are priorities and needs of Baby's Hunters Point.
Thank you. Lisa, you have your question?
Yeah,
Lisa
so yes, thank you so much for that presentation. I was curious to find out, what do you think are sort of the next steps? So First of all, let me back up. Were some of the obstacles during the process? I mean, you mentioned the trust, but what were the other obstacles that you faced? And then what you think would be the next steps if you were to get additional funding? You're on mute.
Hi, Lisa. Thanks for the question. What I get is I think the challenges that we face from just from Dr. Simley is the fact that people feel like we don't want to go in with you and then you just what is this about, right? Like they don't want the program to die. And I think it's like we're always saying, you could just always call me. I'm always, here's my cell phone, but that's not enough, right? So I think it's more security and just a blanket of knowing that we're going to be there. I think those were the challenges of what we face, like just letting them know that the program continues and the warm referrals, right? And I think it's like they just want to stay within our our network, but we're like, no, this is our network too, we're together. So I think those are the challenges that we find is like how can we assure our residents that this program will continue and we will be here to fight and bring these services, right? And just so that's a great question. I hope I answered. But yes,
Dr.
I think those
Palmer,
are
may
the
I ask
challenges.
a question? Dr. Palmer, may I ask a question?
Sure, go ahead. Lisa, you still have your hand up?
Sure, go ahead, Lisa. I was just asking, like, what are the next steps with additional funding? It's just continuing the program as is, or was there some other things that you wanted to do? Lisa, you're on mute.
Yeah, so I'm so sorry. So the next steps, right? If we was to get additional funding, I think the next steps is not only for us to continue, but somehow wrap like build this out to where we can do direct referrals to UCSF, right? Or to General Hospital. But also like maybe get a satellite pharmacy, something where we can actually, build a pharmacy because there's a pharmacy area, 5800 3rd Street, and that's like an area where all the buses come, the seniors can walk, it's like a regiment they have to get back into. But the familiarity, right? Like getting them back to getting out, right? Because they're inside, they're inside their house. So I think those are next steps, creating a satellite, creating a bridge with us with UCSF and General Hospital and seeing, how we can really fill in these gaps.
Great. Thank you, Lisa.
Thank you, Lisa. Thank you. Hi, Gary.
Hey, how are you? Thank you, Lisa, for your presentation. And thank you, Ms. Taylor, for your questions. Those are very important. Sustainability is my concern, right? What are you doing with regards to developing an infrastructure that can be sustained because you're multifaceted, right? You're doing navigation, you're doing pharmaceutical infrastructure development, you're doing so many aspects of community engagement. I want to know, what about sustainability? And I'm talking about in terms of funding, right? That can carry your program from one step to the next and then to the furthest most part. Please. You're on mute. You're on mute.
Lisa, you're on mute.
Okay, Gary. Sorry. Okay, Gary, that's an incredible, great question because actually with Prop 1 being passed and my work with behavioral health services, there is a way with this model, right? The integration of this model that we just provided here, I'm actually able to tap into federal funding. So we will actually be able, as United in Love, to actually be able to submit to the FD. I have a paper here on it, but we actually can submit to federal funding now because of Prop 1. And I feel like this will not only just us reaching for funding and just looking for grants. This will actually make us an agent of how do you say, like, if we start having federal funding, we become an acting agent of the state. So that is something that we did research. And because we are able to do Medi-Cal billing, we're actually able to submit this proposal for medical billing through Prop 1 funding. So that way we can actually tap into federal reserves. So I believe that is something we found out just maybe a month ago, and that is something that we're trying to push forward as far as us being a component of federal funding and actually being able to tap into the prop funds that actually got approved. I hope that answers that question.
Yeah, it truly did. That's a very broad scope of investment that you're approaching, that you're looking at.
I mean, unless you got some other ideas, but that is so far something we saw.
Oh no, I'm impressed. That's very good. Thank you. I'm impressed. That's very good. Thank you.
Okay, thank you.
If I can just add, one of the other opportunities that we've been thinking through is how to integrate the community health workers and the programs that are being provided through United in Love as billable services that will support patient care from the UCSF angle as well. So one example is, is there a possibility for, let's say, the Osher Center to have a partial FTA for a community health worker that is situated in the Bayview, that's working, that's part of United in Health, like United in Love, right? So to help build out the staff within United in Love and think about funding models that perhaps aren't a pot of money, but rather personnel to help do the work within the community.
Have you considered patient-led navigation, where they've gone through your program, understand the community and the resource needs, and then are able to then transfer that information back into the community?
Yeah, thank you, Gary. Yeah, that's what I was intending to specify. So folks from United in Love, that would be the peer navigators, the community health workers, but that there's a vehicle within UCSF to help fund that as a stable position, with the intention of them, helping to navigate into services at UCSF. We're really thinking about it. Lisa, it was an example with the pharmacy needing a pharmacy there. Like, this is substantial investment, and it needs to come from players outside of Bayview's 100 Point who really have the resources, as well as the resources being money, but also resources like, how are they going to kind of come up with the vendors to bring back into that space? All of those components, and that is far beyond United in Love's capacity, but making sure that United in Love is really driving the work so that the vision is retained.
Rox, you have your hand up?
Yeah, I have a question. Just an idea. I love the work that you're doing at United in Love, and we at UCSF, we have the committee on training and navigation. I'm hearing my I'm hearing my echo, sorry. But But Lisa and Dr. Morris, like I know that City College of San Francisco has like a CHW, one of like the first CHW training programs. And I wonder because of the good work that you're already doing and how to kind of show the new generation, because I want to retire soon. So I want a new generation of people and hopefully the youth and the Bayview to explore, right? Like CHW work, if they already know, oh, you got to go here for that, but actually like the actual hands-on training and then like just and really I'm talking about workforce development. And so I'm just wondering if you have thought about I get sustainability for the program, the sustainability for the people to like do the work moving forward. And if Lisa and Dr. Morris, if you don't know Daruni, who's the head of City College CHW program, let's connect. So I would love to just connect you to her because she told us, she goes, there's 5 cohorts of people in CHW programs. So people are excited about the work and would love to just like, plant the seed for the younger generation.
How are you dealing with the multi-ethnic, multilingual aspects of your community?
Gary, before you jump in, Lisa, you're having some audio issues, so every time someone wants to speak, we have to mute you. But I'm going to, if I'll give you space to respond to Rock.
Oh my gosh, I am loving that idea. I couldn't heart you. I was trying to do the Zoom thing where the hearts come through, but I love that. I love that we have young community healers. So this is, Dr. Morris, this is right with the work we do. I love that. We can't have enough hands-on young healers out there. This is the career pathway program. So this goes right into figures. So thank you. I love this. This is great. Yes. Sorry about that. Thank you, Dr. Palmer. I believe Gary, you were next.
No, I actually just blurted that out, and I'm sorry. I wanted to know, how are you dealing with the multi-ethnic, multilingual aspects of your community in terms of them participating in your program? You're on mute.
Yeah, so when it comes to multilingual, I have Linda. Linda, she speaks Mandarin and Cantonese. And then when it comes to Spanish, my Spanish is poquito, like, but I get along with the Spanish speakers. Like we somehow like, man, when it comes to pain and when it comes to like just the human passion, like contact, like there's no words that will get in the way of that. Like it's like right here. But when it comes to barriers, it will only be Cantonese or Mandarin sometimes. But so far, like the Samoan community, the Black community, even the Spanish community, we somehow have we can, we get along to where we're able to understand what they need. We're able to meet their needs.
Okay.
Mm-hmm.
We may have time for perhaps one more question or comment.
I could have put more slides on here, man. I had like a whole bunch of slides, but I was I had a whole bunch of slides, but it's all good. But yes, ask away because even though I present it, I always feel like I like to engage, I like to boots on the ground. So ask away.
Awesome. Well, wonderful job sharing the work that you all do. Thank you so much for coming to bring your updates with us. We greatly appreciate it. And just to clarify, just in case it was missed earlier, these 2 awardees were awarded last year, 2025 to 2026. And I know that there are some folks who applied for this year, so we're still making decisions around the applications that came in. So there'll be more information that comes out on that later. And there'll be more to come. So we look forward to hearing more from these partners who received the funding. And certainly feel free to check out the chat. There's lots of great comments for you. And thanks for the presentation. And certainly appreciate everyone else joining us today. And we look forward to seeing you at either the next CAB meeting and then certainly the next CAB 2 meeting.